Trigeminal is a nerve which supplies and takes a sensation from the face to the brain, and different muscles are also controlled by it. And neuralgia is any pain which happens because there is an irritation to that nerve. Now, typically the symptoms of trigeminal neuralgia are sharp electric shock-like pain, which is episodic. It might last for a few seconds or a minute, and it happens more largely on one side of your face. So it can happen on your lower face, in your lower jaw, mid of the face, or upper face. And most of the time, patient thinks that the pain is coming from one of the tooth. And whenever patient comes to us, they have a history of extraction of multiple tooths on that particular side of the jaw without any relief. And when you do an MRI, you find that there is a compression on the nerve, on trigeminal nerve. Most of the time, we do not know the reason of the disease, and sometimes your MRIs can be normal. Other causes of trigeminal neuralgia are simple tumors which can sit near the nerve and the region called as CP angle, and they can irritate or stretch the nerve, which can cause this severe pain. Now, symptoms of this pain, the severity of the pain is extremely high. It is a sharp pain, and for a few seconds the patient becomes absolutely debilitated. So much so that most of the patients who come to us have a major component of depression because it affects their life very, very adversely. Coming to the treatment part of the trigeminal neuralgia, as I've already discussed in previous videos, trigeminal neuralgia treatment can be broadly divided into three categories or three types. The first treatment, whenever a patient comes to us, is with medicines. There are special medicines which comes in categories of anticonvulsants and nerve pain relief medicines, which we normally give, and they are first-line medicine or first-line treatment of trigeminal neuralgia. Most of the patients are able to control this pain or are able to reduce the frequency and intensity of this pain with simple medicines. And with serial monitoring, we can keep them under observation, and most of the patients do well with medicines. Now, the second set of the treatment or the second arm of the treatment is surgery. This surgery is important in those cases where in MRI you find a vascular loop or a vessel of your artery hitting on the trigeminal nerve. It is very clearly evident on your MRI, or you have a tumor which is sitting or irritating the nerve. Now, in those cases, if we are able to remove the artery from the nerve, we create a space, or if we are able to take the tumor out successfully under microscope, the patients get immediately relief from the surgery, and most of the time this relief is permanent. Now, the third set of treatment is called as injections or applications. They basically involve putting a needle or a balloon in the area where your trigeminal nerve starts to come on the face, and you burn that nerve or you compress the nerve so that the nerve cells becomes damaged or they are not able to conduct the pain sensations. Now, these are called as radiofrequency ablation or balloon compression of the trigeminal nerve. This is not a common procedure. I mean, we do it in patients who are not good surgical candidates or who do not wish to go for surgery. As I said, these are usually permanent, and they might leave you with some anesthesia on the face. But again, this can be tried in patients who are really poor candidates of surgery, who are very elderly, who have a lot of other diseases like heart or severe asthma and other things where the surgery becomes challenging. I hope this information was helpful.